Alright, this is the lower extremity test. So first off, I just start with an inspection of the area for um, any skin lesions, dryness, anything like that. And then I move on to the palpation of the legs, check for temperature changes, note where it's warmer and colder. And checking for dryness with that palpation as well. And I do that with the back of my hands as well. And I check for trophic changes, and then I would move in onto the feet, and I would do the compression test on the nail beds, and just making sure they all go back to the same color after doing the compression test. Then I would go on to check the heart rate or the pulse. All the different positionings on the feet or on the lower extremity. So I'd first start with dorsalis pedis. And then I'd move on to posterior tibial. So that's posterior to the medial malleolus. And then I would bend the knee slightly and look for popliteal. And then I would check for the femoral, and in this situation I'd have the patient take it and place it on the femoral, or that's an option just for comfortability reasons. Yep, there it is. And then I would go on to check for pitting edema, and I would I'd compress just at different parts on the anterior part of the lower leg, and make sure that it comes, basically that the skin and muscle come back to the surface quickly, and make sure they don't stay compressed. And then I would, I'd palpate the skin for thickening of the ankle areas, and that could be indicative of lymphedema and venous insufficiency. Then I'm going to move on to lymph nodes. So I palpate lymph node area by the inguinal ligament, and then I move on to femoral auscultation, and I would listen for, I guess you can do this. Yeah, I already did that. And then I would check for hernia. Bear down. Does that hurt at all?
Nope.
No. And then I'd do Homan's, or do Homan sign. So I would 45 degree with the leg, and then I would dorsiflex the ankle, and then I would squeeze along the leg. And if it was painful, then it'd be positive Homan sign. Did any of that hurt?
Nope.
No? Alright. And then leg elevation test, I'd hold the patient's legs at 45 degrees, and then I'd ask them to paddle like they're swimming. And basically you do it for about 60 seconds, and if pain diminishes or pulse diminishes, it could be arterial insufficiency. And then I'd move on to the venous tap test, so I'll have the patient stand up, and I would ask him to flex his thigh. Just kidding. So I would feel for the pulse, and then I would tap from superior to inferior and feel for palpably transmitted impulse. And that's it.